teeth and our digestive system is long like sheep and the lion and the other animals which eat lots of flesh.
This is a book you read where it tells you, well, reduce the amount.
Lots of programs I try to practice, and I'm confused, really. I just want to
Iman, don't be confused. I tell you simple history. Your ancestors, you know, you're a caveman, huh? Our gene is coming from our ancestors, from 200, 300, or 400 million years. So you are the same person which your grandfather, they used to eat only on hunting. There was nothing. And they have only 4 canine, as you mentioned. So there was no problem with them. They used to live 400 years, 500 years. Even O group, the oldest, you know, O group means oldest. These people, their genetics, they used to eat only
meat.
High protein diet. Even there was no seed. There was no seed during that time. The agriculture, as I mentioned, started 10 million years later. So don't worry, don't be confused. What I'm trying, don't be confused, my dear. What I'm trying, I said, okay, eat as much as you can, you are satisfied. I'm not easing you. Don't overeat. Don't put yourself. Eat as if you are hungry. Don't eat if you are not hungry. I'm telling you, eat some good vegetables, good carbohydrate. I'm not saying don't eat. I'm not saying don't. If you want to eat meat for once or twice in a week, so good. Try to eat fish. Okay. Forget about meat. Eat fish. Forget about fish. Eat poultry, chicken, and so on. There's so many, it's a vast things. It's not a question. People, unfortunately, whether they understand or they don't understand, they are trying to criticize things without really knowledge-wise.
But, doctor, excuse me, somebody said to me that ketogenic diet is a history. A lot of people get away from this kind of diet.
No. Tell me, ketogenic diet till now, all over the world, they are treating patients with epilepsy. I'm sure you people know it more than I do.
You know, epilepsy, actually, it becomes...
seizures,
fits. Seizure and fits. Actually, it becomes when there is nuclear problems in the brain where become a small, tiny part of the brain becomes overactive. Too much electricity. And that electricity goes all over the brain. And by reducing the sugar, by reducing that fast energy,
absorption,
will you reduce the electrical energy of the brain, and which is very beneficial to the people with epilepsy.
And this is started in 1920 this way, and they treated children with ketogenic diet with a high amount of fat. For 4 years, 8% or 5% of the male boys develop kidney stone. And kidney stone is nothing compared to the problem. Now, there are all over the Europe and the United States, there are centers where they are treating epilepsy. This is one thing. Now, recently, there is
Doctor, we have Sarah on the line. She is a colleague, and we'll go back to, I'm sorry to interrupt you. Hello, Sarah.
Hello.
Sarah, how are you?
Fine, thanks.
Nice to have you with us.
I just wanted to say that I have an advice or another way of suggestion. It's really because I was an overweight, and it's really could help, you know, but I don't know if it's healthy or not, you know. When I want to eat, I think that I should eat to have an energy, you know. And if I think that I want maybe a cake or something, I should eat 1 glass of water and then wait a half an hour, you know, and see if I want this cake or not. Then it's tell me that if I want the cake for eating or to have an energy, you know. That's it. Thanks.
Well, hello?
Hello?
Sarah, how much you was weighing before?
50, yeah. 50 kilo.
50 kilo?
Yeah.
50 kilo before the operation?
Kilogram? Yeah.
And now?
Now 40 and 40.
How old are you?
13.
13, okay. Well, Dr. Hussein Dashti will answer you. Did you get Sarah's answer? A question?
No, I couldn't get her what
Sarah.
she was talking. What she was just summarize, because I don't want to hear.
Sarah,
hello? Summarize it for me.
Yeah, she said, well...
she was 50 kilogram, now she's 40 after operation. Now how old is she?
She's 13
She's 13.
Well, let me put it this way. Usually, I don't advocate ketogenic diet for the patient who is below 12 and 13 for a simple reason, because they are in the growing age group.
Yes.
Okay? Now, this is one thing. Now, when I'm going to advise them, I advise the parents just to stop them to have high glycemic index. That's all.
So
you know,
you advise them to eat the low glycemic
low
index.
glycemic, let them have a good, but cakes, as she mentioned, is high glycemic index. It's
Yeah.
terrible.